So that might help us move into some of the components that we can influence as massage therapists, because, moving fluid, reducing the amount of cross links, creating that movement between the layers of tissue, that's all our purview. So let's talk about that a little bit, Cathy.
Yeah, when I was doing some of the research for the book and I was reading, because I had to step outside of massage therapy research in order to pull some of this information together, so I started to take the deep dive into the who's who of wound healing research of the world. And what I started to see in reading this research is, it kind of, we're talking about the overproduction of anomalous collagen or fibrotic collagen that is, essentially the hallmark characteristic feature of problematic scars. When we're talking about the construct, there are two things that everybody had agreed on of the who's who of wound healing. And basically the two primary drivers are excessive prolonged inflammation, including its component of swelling, and then anomalous tissue tension. Those are the two things that can really drive the production of problematic scars. When I saw that in the research, I was like, so excited, because if we look at those things, those are two things that fall so squarely within our wheelhouse as massage therapists. And for me, it really solidified how we have the capability to intervene in the early stages to help promote better outcomes happening, or maybe prevent some of these problems from happening in the first place. Because if there's something that these hands can do, we can move fluid, excess fluid out of an area, and we can definitely impact tension.
Yeah, for sure. Moving fluid is one of our historical, it's one of our most foundational tenets. But when we were starting as a profession, I think mostly we were thinking about blood fluid. But now we have so much more of an understanding about lymph fluid and the effect and the role that this plays in the body in so many different ways. And I know those of you who have taken level 2 of our mastectomy guide courses, that how influential the moving the lymph is against complications arising from surgery, because complications are not uncommon, unfortunately. And a lot of them are actually related to lymph stasis, and it's not moving. And so the body can't get the resources that it needs to the area, can't regenerate in the way that it needs to. And it creates, this sort of cascading series of issues that can happen. So if we can move that fluid along in a healthy way, then the tissues are closer together, they're cleaner, they're able to regenerate themselves more effectively, and to help promote that healthy movement or healthy development of the scar tissue.
Definitely a big factor in helping to facilitate or support a better wound healing environment, for sure.
Yeah. And environment is so key, right? I think environment is one of the most important things, Cathy.
It is. I mean, that is a really important part of those initial stages of wound healing, is what's happening in the environment. Who is there and what they're doing, and are they in the right amount, or are they overdoing it? Can really have a big impact on the ultimate outcome.
Yeah, totally. Now, what about the nervous system? What's your take on how the nervous system influences scar tissue development?
Well, there have been some great studies on, just those things driven by the nervous system. I mean, certainly the nervous system is the grand conductor of a lot of what's going on. So, if the nervous system is hyperexcited, we're going to see maybe more of certain things in an area that aren't really necessary or needed, that can potentially be contributors to problematic scars, for sure. And definitely there's a number of studies about the impact of stress and anxiety on healing outcomes. So, from my perspective, I think one of the most important things that we can do in those early stages of wound healing is our ability to, have a good conversation with the person's nervous system, in particular the autonomic nervous system, where we can help to, facilitate better balance in the autonomic nervous system, so that we don't see this hypervigilant or hypersensory kind of state. and certainly that is a key to, as we know, pain translation. So something going from an acute pain situation into more of a complex or chronic pain type of state.
Right. Yeah. And the nervous system, like when it's overwrought, the person cannot settle properly, their sleep is interrupted, their capacity to have healthy blood flow to an area to feed their organs and all the different things that are required for a body to be able to heal itself, all of those get interrupted as well. And working with the nervous system is one of the things I think as massage therapists that we have one of the most influences over. It's, as soon as you touch the skin, you're touching the nervous system because all the nerves are just attached right to the dermis system. And every time we have some kind of intervention with the skin, then the nervous system is interacting. It's, it's all due to sensory, it all has that sensory component to it. Plus, of course, there's all the motor tissues and motor nerves and also you were talking the other day, this is more talking about the skin here, but the skin's role in proprioception. Super fascinating. Maybe you can share something about that.
Yeah, and I mean, and that comes out of my fascial obsession and the phenomenal opportunity that I've had to attend most of the international fascia research congresses. And, back in the day when I went through massage therapy school, proprioception was always kind of regulated to muscle spindles and Golgis, right? That was all that was kind of our proprioceptors. And there wasn't really any kind of information at the time about just how richly supplied both our skin and superficial fascia are with proprioceptive types of nerve endings, mechanoreceptors. So, what I've seen in, some of the scar tissue work, that even something that looks like, more of an issue of a superficial scar, potentially can have some kind of impact on a person's proprioceptive system. One of the things that Nancy and I talk about in the book, and I held the book up because somebody asked for the title again. One of the things that Nancy and I talk about in the book is what we would describe as proprioceptive disinformation. So, when the proprioceptive system is off, it's a very difficult situation in that the information that's being gathered out in our tissues goes to the brain, but it's a jumbled message. And the brain's like, well, okay, I don't know when you should do this or that. And, so there's this like communication breakdown that's happening. So I think it's just really important for us to be mindful that can even happen at the skin level, and to pay attention to, things that we might be finding at the skin level and how that might impact proprioceptive, coordination and control of movement. Yeah. Someone's got a question here about the nervous system. If it's overstimulated in the area, what are some of the specific symptoms that we will see? I don't know so much that it's something locally that I will see, but when we see an overstimulated nervous system, certainly would be any of those things that we would associate with some kind of autonomic, imbalance between parasympathetic and sympathetics type of thing. I mean, locally, I suppose what we would see are some of those things that we might see with that kind of thing would be like sweating in an area where maybe, it's not a particularly hot day, so any of those things that we might associate with some kind of sympathetic to parasympathetic imbalance.
Yeah, like shallow breathing, more rapid.
Hypersensitivity of the tissue, that would be another local kind of thing, for sure. So an area that is just really like, people will come in sometime in my practice and say, I can't even stand wearing a shirt, a light shirt, just the feel of my, shirt dragging across my skin. It's just like, it's too much, it's overwhelming. So those might be a couple of things that I might see locally. Yeah.
So let's talk about the collagen and connective tissue. How is that something that we can influence as massage therapists?
I kind of break it down to two things. We can impact the fiber and some of those quality and quantity and orientation things that we talk about, and we can impact the fluid. So you mentioned the shift from the fluid in an area being, more of a gelatinous, gooey, sticky state to something that's more fluid that would support, sliding, gliding, juiciness, and pliability. So for me, it's just, I kind of simplify it down into we can affect the fiber and we can affect the fluid environment.
Yeah. And I think those are two things that can really help a scar to feel not as tough, not as dense, not as restrictive. And certainly scar tissue can look very, kind of dramatic, really, where it's like rumpled and crumpled and it's really a dark color and it's got these nodules and it can be like suctioned into the chest in some areas and, crawling out of its little hidey hole in other areas. And, it's a very noticeable, prominent thing. And the studies that I've read that show if the scar is more comfortable, it's more elastic, and the color can go down, then people's ability to accept the scar goes way up. But if that uncomfortableness is always there, that vivid color is always there, that feeling of pulling or restriction every time that they move is always there, their ability to integrate the scar into their mental schema of who they are now goes down, which I think makes sense, right?
Yeah, and I just want to quickly respond. Somebody made the note there where when we're talking about some local, what we might see specific symptoms related to a hypersensitive nervous system and redness. Well, the redness I would attribute more to a hypervascularity kind of thing rather than oversensitized nervous system type of thing. So just to kind of take a quick note on that. And yes, so as we talked about earlier, sometimes a scar can have more than its normal blood supply, because what we do see in the early days of wound healing, there is that, development of new blood vessels, and the body will intentionally overdo it initially. We do see that hypervascularity in the early stages of wound healing. If the process is going well, there will be regression, and at the end of it, the tissue will have what is considered to be its appropriate amount of supply. But if things don't go well, sometimes that hypervascularity will persist for much longer than what it should.
Yeah.